I want to call to order the Assembly Budget Sub 1, Health and Human Services. I want to welcome you all here today to this very important meeting of April 7th. We'll be looking at items 4260 today with a number of, with 22 issues contained within them, some a little bit more complicated than others, some almost basically perform in terms of things that we're funding based on bills that were enacted last year and so forth. So with that in mind, we want to call forth those individuals who are dealing with issue 1, which is the restoration of Medicare optional benefits. Doesn't bother me any, but it's okay. Thank you and welcome.
Thank you. Toby Douglas, Director of the Department of Healthcare Services. So the first item relates to restoration of... Oh, no, I'd rather. Are you...
Sure. Thank you, Madam Chair. Ross Brown with the Legislative Analyst's Office. We've been asked to present the first issue on your agenda. Through the 2009 Budget Act and Health Trailer Bill, the state eliminated several Medicaid optional benefits, Medi-Cal optional benefits, including acupuncture, audiology, adult dental services, and you have a helpful table on page 2 of your agenda that outlines some of those benefits and some of the potential costs associated with those benefits. These benefits were eliminated for budgetary and not policy reasons in response to the state's fiscal crisis. There's a question in your agenda that asked us to present on any analysis we've done on the effect of the elimination of these benefits. We haven't conducted any such analysis. We do have some general comments about proposals such as these to restore benefits that have been eliminated or cuts that have been made in previous years. In light of the state's improving fiscal condition, we, as an office, do believe that the legislature should put a high priority on building a prudent reserve and paying off debts and other budgetary obligations. However, we also think it's reasonable for the legislature to begin to consider making some targeted restorations of things that have been eliminated in the past. And in general, these are just a matter of legislative priorities, and so it's difficult for us to comment on the relative merits of each one, but we will continue to provide assistance to you and staff if you have any further questions for us.
Okay. Thank you. Any other presentations, comments? Yes.
Madam Chair, Yang with the Department of Finance. I just want to make a quick note that this is not administration's proposal, and therefore the funding for this restoration is not included in the governor's budget. As Mr. Brown has pointed out, the governor's budget is focused on using some of these one-time revenue from capital gains for one-time expenditures such as capital state's infrastructure, pay down debts, and building a reserve. Given that this restoration would commit ongoing funding beyond what's included in the governor's budget, the Department of Finance would have to oppose this proposal for the time being.
Fine. Any other comments, questions? Yes.
There's a question in the analysis asking about the restoration of adult dental benefits for pregnant women, and the answer is yes, that they will be available, and we're working to make sure that the full array of dental services are available to all populations.
Okay, wonderful. Okay, anyone else? Okay, we have none of our legislators are here, so that means I'm the only one asking questions, huh? Well, let's see if there's public comments. Any public comments? I'm going to limit you to 1 minute.
Good afternoon, Madam Chair. Just want to thank the department for the statement that the pregnant women in all eligibility categories, if I understood correctly, will be included in this partial restoration of the adult dental benefit May 1st, or did I misunderstand which pregnant women the director was talking about?
Well, I always get concerned when Lucia, there's something I'm missing. But the answer is, yeah, pregnant, just as it is today when we say it for our pregnancy-only programs to the extent that it's medically necessary for for the pregnant woman, and then the dental benefits, the full array of those that are being restored, will be available.
That is excellent news and most welcome. We think it's the absolute right policy decision. We think it's also the legally required decision, but the most important thing here is that the families will be getting the service. And we extend our heartfelt thanks for that announcement. Thank you.
Thank you. Great.
Vanessa Hina with the Western Center on Law and Poverty. Also very much appreciate the clarification from the department about the dental services available to pregnant women. We would also encourage the legislature to explore full restoration of adult dental services this year. Of all of the cuts that we've made in the budget as a result of a budget crisis that we're now coming out of, we believe that dental services have affected our clients the most negatively in terms of their living in pain, not being able to find jobs because they're missing teeth. A full restoration would ensure that somebody who needs bridge work or partial dentures is able to get those services, and we encourage you to look at that solution as we go into May revise. Thank you.
Thank you.
Rain Hicks, Californians Disability Rights, and as a person who has a disability and know other people who have disabilities, one of the things is that they don't get dental benefit is that it exacerbates that disability. It causes either periodontitis, which means it can become kind of poisoning, and also what it does, it is, as she says, it's very hard for some people to be embarrassed in society about it, and especially if they have a mental health issue. This will even make them more likely to exacerbate that mental health issue. So yes, we thank the department for what they did do for partial restoration, but we really need to have full restoration to make sure people live in a good society. Thank you.
Thank you. Thank you.
Madam Chairman and members, Barry Brokaw on behalf of the California Academy of Audiology, representing the state's licensed audiologist. And since 2009, there's been a real quandary providing audiological services for folks because of the cutbacks of the programs. And it's left people with choices. Audiologists can either not do the workup that they would provide for their regular patients, their non-Medi-Cal patients, or they provide the services at a significant loss because they can't get reimbursed for those expenditures, or they don't see people. We're seeing that with major hospitals, the children's hospitals, that aren't providing the audiological services across the state that they used to, and a declining number of practitioners because of this. Without hearing, people can't communicate, they can't make things go in society, and we hope you'll consider restoration of those really important benefits. Thank you.
Thank you.
Madam Chair and members, Doug Kim with the Primary Care Association. We have two concerns regarding the adult dental. First, as you're probably aware, there is a federal appellate decision requiring that full dental benefits be provided to patients of federally qualified health centers. We're concerned that in the proposal that only the partial dental benefits that were authorized in the budget trailer bill last year are going to be available. Secondly, we are very concerned that during the 4-year hiatus between when the litigation was pending, our health centers continued to provide dental care to our patients, and there apparently at this point is no opportunity for them to be compensated for their costs at that time, and we'd like to visit that issue at a later time. Thank you.
Thank you.
Beth Capel for Health Access California. We oppose these cuts. We support their restoration.
Thank you very much. Okay. I think you've answered our question that we had concerning the benefits for pregnant women, and obviously this is an issue that is a priority for the members of the Assembly. So, and we've had significant discussions concerning the benefits of adult dental as well as podiatry care and others that are listed here. So, thank you very much. We know it's not in the governor's budget. It's one of the priorities of members of the Assembly. That moves us to the second item, which is Meaningful Use Incentive Program. Okay.
Again, Toby Douglas, Department of Healthcare Services. So as part of 2009 American Recovery and Reinvestment Act, known as ARA, a big piece of it was the High-Tech Act that provided funding to adoption of electronic technology, of transition of electronic health information. And the department has been responsible for the electronic health record incentive program. And through this program that's fully federally funded, we have worked with providers, Medi-Cal providers, to adopt electronic health records and have paid out over $1 billion to providers. And this is to facilitate what we call meaningful use, sharing data across health information, using it for care management, care coordination, as a way that we're getting at the end goal of improving health outcomes, the delivery of care, improving the experience, and reducing overall costs. As part of this as well, we've had different associations working on providing technical assistance. That funding was separate and has ended, but we have an ability under the EHR incentive program to get federal funding at 90% reimbursement to continue this technical assistance activities. But we at this point have not received the 10%. We've looked to foundations and others. And so while we have proposed this to our federal partners and received approval, we still need to find the 10% match to get it.
Thank you. Any comments from Finance?
Yes, Madam Chair. Bruce Lee with Finance. I'm glad there's a correction to a misnomer. There was a misnomer that there was no funding included in the governor's budget for this proposal. But yes, in policy change 11 of the administration and the Medi-Cal estimate, it is fully funded. It is looking at the $37.5 million federal fund and then a $4.1 million match in other funds. Due to state statute in the Welfare and Institutions Code 14046.7, that prohibits general fund from being used for this purpose, for this program. And so the department is continuing to pursue and find the matching funds. And fortunately, there is no particular deadline, I understand, from the department as to when the grant will expire, so it can be moved into other years if necessary.
Thank you. Any comments from LEO? Okay. This item will be held over. Any public comments on this? Sorry about that. Okay, fine. And this item, as the other item, item 1, will be held over for continuing of the issue. Okay, item number 3, Affordable Care Act Pregnancy Services.
Hi, Madam Chair. Mary Cantwell, Department of Health Care Services. So this issue relates to the governor's proposal related to pregnancy services. This proposal has 2 components. It establishes a new income standard for qualified low-income pregnant women under Medi-Cal, which provides full-scope, no-cost Medi-Cal services for those who have incomes at or below 109% of the federal poverty level. The second component is that it creates an affordability and benefit wrap program for pregnant women above 109% of the federal poverty level and up to 208% of that level, who are enrolled in a qualified health plan through Covered California. These are women who would otherwise be eligible only for limited scope Medi-Cal. Under this program, DHCS would cover the out-of-pocket expenditures of pregnant women enrolled in a qualified health plan. The out-of-pocket expenditures include premium amounts owed after the premium tax credits are applied, any applicable cost-sharing, co-payments, or any other covered costs that are required during their pregnancy and postpartum coverage. For services not covered by the QHP that are Medi-Cal covered benefits, the women may access such medically necessary services outside of the QHP through the Medi-Cal fee-for-service program. An excellent example of that would be dental services. The affordability and benefit program would be made available the later of either January 1st, 2015, or when DHCS determines that CalHERS is operational to effectuate the policy. The budget does assume general fund savings of $17 million in the budget year related to the pregnancy wrap. Those savings represent the cost difference to Medi-Cal of providing the wrap versus providing limited scope Medi-Cal services. There were several questions outlined in the agenda. First, with regards to our analysis of how Medi-Cal managed care plans provide CPSP services. Our plans are required to provide these services under their contracts with us. The plans provide these services either through contracting with CPSP providers or with other providers, as long as they are providing all of the CPSP services that the beneficiary is seeking. In addition, some women in managed care plans seek and receive CPSP services directly through Medi-Cal fee-for-service. We've also been asked to provide an update on our analysis of whether the qualified health plans in Covered California offer CPSP services. That analysis is still underway. We have reached out to several of the larger qualified health plans and are reviewing their evidence of coverage and getting more detail from them to understand the degree to which these services are covered. We have begun to hear from some of those plans that they do believe that they cover these same services, although our analysis, as I said, is still ongoing. In terms of the differences in the benefits and costs between full scope and limited scope coverage, the covered services under the Medi-Cal state plan that are available to pregnant women are based on medical necessity, and any service can be provided in pregnancy-only coverage when it's related to their pregnancy or conditions that may cause complications to their pregnancy. When we look generally at the costs in fee-for-service for pregnant women, generally we see that the costs for full scope and limited scope pregnancy services are generally the same. In terms of if the RAP is enacted, how we would propose to inform women of their options, we actually have several ways that we're going to be doing this, including at the time of application, including providing information in the paper application and on the online enrollment site, via FAQs to providers, consumer advocates, and enrollment counselors. We'll be incorporating the information into welcome packets for our new enrollees, as well as into beneficiary notices for existing enrollees, and as general information available on our website. We do believe that the key to the success of our outreach and messaging on this initiative will be for us to partner with consumer advocates, provider associations, and our colleagues at Covered California. The next question was to how we would inform Medi-Cal eligible pregnant women of their right to receive services that are not covered by the QHP. This would also be included in the welcome packet information once eligibility is determined under Medi-Cal, and we will also be working closely with Covered California in terms of assuring that their plans and call centers are informed of these services. And again, we'd be looking to work with stakeholders for other ideas on how to ensure that this information is made available. And then finally, in terms of how we propose to coordinate pregnancy-related services outside of the qualified health plan, while it's generally a plan responsibility to coordinate care, we will be working closely with Covered California and the qualified health plans in terms of how this policy will be implemented. And just to be clear, though, for purposes of accessing these services under Medi-Cal, the services would be provided in the fee-for-service system.
Okay, thank you very much.
Welcome.
Any comments from Finance? LAO? Mm-hmm.
Thank you, Madam Chair. In general, we feel this proposal has a lot of merit. First, the proposal to shift some of the pregnant women above 109% up to 208 would likely result in some general fund savings while potentially providing more generous benefits to those pregnant women. As far as the proposal to provide full scope coverage to pregnant women below 109%, that could eliminate some current inconsistencies in coverage that depend on whether or not a woman is pregnant at a time of application or not. So we think there's a lot of merit to that part of the proposal as well. However, we have raised a few issues about the proposal that deserve some further analysis. One is a fiscal issue. The budget assumes that there is no difference in cost between full scope coverage versus pregnancy only coverage, and so we are continuing to look at the methodology that the administration used in order to make that assumption, but we think that there may be some additional costs associated with that change that have not been accounted for in the budget. And there are some other issues related to the provision of the CPSP services and how they will be provided for pregnant women who may be obtaining coverage through Covered California. And as Ms. Cantwell mentioned, they are continuing to look at that issue. So our recommendation on this item is to hold it open pending further analysis of some of these issues.
Okay, fine. Okay. You answered most of the questions I had. Thank you. In terms of implementation, you each have a minute for the audience. Yes. Mm-hmm.
Thank you. Lynn Kersey, Maternal and Child Health Access in Los Angeles, and we strongly support and thank the department for the decision to take, or the recommendation to take full scope to 109% of poverty level for pregnant women to help ease the confusion and stair-stepping that happen with some women being pregnancy-related, some women being full scope. We think it should go to even 213%, so there's even less confusion. We have major concerns about the premium assistance proposal because of the way that CPSP is provided, the Comprehensive Perinatal Services Program. They are a Medi-Cal benefit offering a wide range of services to pregnant women in nutrition, health education, and psychosocial services. The provider does an assessment and sees the woman quarterly and assesses again quarterly for these issues. That same level of assessment is not in the qualified health plans that we've looked at for many of the services that Medi-Cal recipients are eligible for. We look forward to the department's analysis of CPSP-like services in the qualified health plans, but we just don't think they're there. One example is dental care, for example, which was mentioned. Dental care can be a handoff referral, or it can be sitting down with a woman and helping her understand the need for dental care, why she might be having bleeding in her gums, and that she is eligible for and should receive all dental services available to her. And there's very different levels of that kind of service.
Would you please conclude?
Pardon me? Yes, thank you. The Cover California plans are not required to provide CPSP, and we look forward to the department's analysis and working with the department on how this might work. Thank you.
Hi, Justin Garrett with the March of Dimes. We support ensuring comprehensive coverage for pregnant women and had 3 concerns that I wanted to share regarding this proposal. We also support expanding full scope coverage to women beyond 109%. We are thankful for expanding it up to 109%. We want to ensure that the mechanism in place for the WRAP does effectively allow for women to access the important benefits such as CPSP. And then we also want to make sure that women do have the proper information to make an informed decision about which coverage options are best for them. Thanks.
Thank you.
Good afternoon. Holly Langbein on behalf of the California Nurse Midwives Association. While we're generally supportive of the proposal, we would like to ensure that it includes access to both CPSP services and certified nurse midwives, which is a federally mandated benefit. Thank you.
Thank you.
Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists for California. Not quite as succinct as March of Dimes, but we echo all of their comments. Actually, literally, we might echo some of their comments in this room. But one thing to really note is not all pregnant women will be eligible to get a Covered California policy. So if she's not pregnant, or if she's not doesn't have a policy at the time of pregnancy, pregnancy is not a qualifying event. So she will not have coverage, can't get coverage, and there will be some women at this point that cannot enroll at any time. We want to, again, make sure that the Medi-Cal services like CPSP, for which the Dr. Ron Chapman just cited in his receipt of an award for the state for reducing the prematurity rate, programs like Comprehensive Perinatal Services Program and the Black Infant Health Program. I can tell you from my physicians that offer the CPSP programs, and they have, say, half insured, half Medi-Cal, it doesn't cross. The CPSP is for the Medi-Cal population. The state has said there's no measurable cost because eventually these women end up getting the services if they are emergency care. So why not go ahead and provide the coverage up front and reduce the administrative costs to both the state and to providers when you have to have these piecemeal systems.
Could you provide a conclusion, please?
Yes. Again, we'd like to go with full scope for all pregnant women and keep working on the details of the pregnancy wrap.
Thank you.
Madam Chair and members, Terry Calgar-Hill on behalf of the California WIC Association, representing the 84 local WIC agencies. Most people are aware of the WIC program providing food vouchers, healthy food prescriptions for pregnant women, their infants, and their children up to age 5. But one of the other components of the WIC program is promoting exclusive breastfeeding for these babies up to the first year of life. And that's also recommended by the American Academy of Pediatrics. So when we look at these, the health plans in Covered California, we cannot find in the evidence of coverage similar detailed breastfeeding and psychosocial support services that are equivalent to what's in the CPSP program. So our basic concerns are about the WRAP and making sure that the services that are provided to these women are comparable to what's in the CPSP program. Thank you very much.
Thank you.
Good afternoon, Brianna Pittman with Planned Parenthood Affiliates of California. Just wanted to say that we support this proposal and the intent of the department and the legislature to expand comprehensive coverage under Medi-Cal and to create the pregnancy wrap to make sure that women can get that comprehensive care. I think that this proposal moves the state in the right direction, and we do understand that there are some concerns about the implementation, and we look forward to working with you and other stakeholders to ensure that women can get all of the access to the services that they deserve. Thank you.
Thank you.
Vanessa Kahina with the Western Center on Law and Poverty. We very much appreciate the department's movement to getting women up to 109% into full scope, no cost Medi-Cal. However, we would also suggest and keep pushing for expansion of full scope Medi-Cal and no cost to pregnant women up to 138% to ensure a bright line of eligibility. We also hope that in the creation of the WRAP that there are truly good notices given out to women so that they have clear and concise choices when they're deciding what kind of coverage to have through their pregnancy for women up to 208% of the federal poverty level. We would also defer to our colleagues at Maternal and Child Health Access as to the implementation and how to expand benefits in the Comprehensive Perinatal Services Program. We look forward to working with you on this and hope that we can get to a decision. Thank you.
Good afternoon. Sarah Muller with the California Association of Public Hospitals and Health Systems. We also would support the expansion of full-scope Medi-Cal up to 138% of the federal poverty level. Thank you.
Madam Chair, Doug Kim with the Primary Care Association. We shared the concerns that were previously expressed. We want to commend the department for increasing access eligibility, and we're particularly concerned about the CPSP issues.
Beth Capel for Health Access California. We support Brightline at 138% of poverty. It makes no sense that one day a woman is a childless adult and she's eligible for Medi-Cal up to 138% of poverty, and the next day when she's pregnant, somehow she's not. So that doesn't make sense to us. One other point, Madam Chair, that we would make is that pregnancy-only Medi-Cal is not minimum essential coverage sufficient to meet the requirements of the mandate. So we commend the administration for trying to assure that women will have coverage that meets the requirement of the individual mandate, and to give them the same zero premium, zero cost sharing, and coordinated benefits that we think they should have.
Thank you very much. We're going to hold this item open pending additional conversation. I'm wanted in another committee. I've got to take we're going to take a 10-minute break for me to get to the committee and do what I've got to do there. So we will, when I return, we'll be at item 5. Thank you.